Let me start with my first question to Greg. Greg, are you there? Yeah. So
Yep.
Greg,
Can you hear me?
okay, yeah. So Greg, I understand that the WHO defined SDoH as one very important criteria for your policy work, right? So could you explain further what SDoH is and why it is so important? And also, has there been any increasing emphasis on SDoH during and after the pandemic?
Yeah, well, first, I just want to say how honored I am to have a chance to be with you all. Yeah, the answer is yes. So, I think we come up with new terms all the time. The new one is social determinants of health. That's work that the network that I oversee in New York has been doing for 50 years, and work that I've been doing personally as a geriatric social worker for 31 years. What the data finally shows, and I think what's getting people's attention, is that about 20% of healthcare spending actually has to do with a healthcare diagnosis or access or lack thereof of care. The other 70 to 80% has to do with where you grow up and how you grow up. Things about safe, affordable housing, your economic situation, access to transportation, access to food. Do you exercise? Do you have clean air and water? How are your communities in terms of violence? Your educational status, language, literacy, and then one that has just become, at least in the United States, but other countries are dealing with it too, is the impact of loneliness and social isolation. So those are things that we've been doing in the network, like I said, that I oversee for a very, very long time. I think the disconnect, especially in the United States, and I can only speak to that, is that we have put all of our eggs in the basket that is the most expensive, wait for people to get sick, show up in places, deal with things in an acute nature, and then send people back home. That will never work. Aging is not the problem. It's not a global problem. The way that we've organized our caring economy, that is the problem. We need to focus much more on front-end solutions, technology, et cetera, which we've been doing here in New York and is being replicated all over the country. But it's great to see an emphasis on this, because oftentimes the best interventions can be things that either don't cost any money or cost very little money, and the outcomes are provable. And that's what we need to continue to work on, is bringing these integrated care models along with technology together.
Thank you. Thank you very much, Greg. So the second question to Ron. Now we understand that SDoH indeed constitute the real foundation of the welfare policies in the States and in New York, right? For your policy work, what were the challenges that you had to cope with when you develop new policies based on this SDoH criteria, and how do you cope with it?
Yeah, I mean, I think our biggest challenge is to build the public administrative capacity to actually deliver services in an efficient manner that has the maximum impact on older adults. Beyond that, we also have a lot of waste in the way that we spend money, because the way that our Medicaid, Medicare insurance, and healthcare for long-term care works is that if you spend the money in the right direction, we can save a lot of money in the back end. In places like New York, what's happening is people in that middle market space that would spend down money, they would impoverish themselves. If we invest properly and use proper technology to serve them, they would not impoverish themselves, and they would not spend down to qualify for low-income Medicaid. So if we spend, for every dollar we spend and administer properly, we can save up to $8 in the back end on Medicaid costs. That's about $2 billion for New York in 5 years. So that's the kind of math that we're putting together, and with the leadership of Greg Olsen and Association for Aging and the new governor and Assemblymember Clyde Vanel, we were able to fully fund the unmet needs, the waiting list of people they're waiting on the sideline in New York State. But we can even do better if we actually apply the efficient tools to administer the programs and capture the capture the problems up front in an efficient manner. And that's the challenge that we're trying to solve today with these collaborative efforts.
I understand. Yes, and I understand also that the aging committee is working very closely with the subcommittee of internet and new technology led by Clyde. And the Clyde, well, as the chair of the committee, what's your point of view on the priority of technology? Do you have any priority technology that you consider as a breakthrough to solve this aging issues for older adults?
So first of all, in New York State, we have to make sure that, one of our major issues that we're focused on and one of our priorities is making sure that we provide the best services we can for older adults. And we want to be able to do it efficiently and save money doing so. Under the leadership of Assemblymember Ron Kim, who's the chair of aging, he is, and part of the reason why I'm here is because he's figuring out, how do we use technology to close that gap and to provide and to address those priorities. One of the things that we've done in New York State with respect to technologies, one of the technologies we've used in the past was automated response systems over the telephone to get information from seniors or what have you. Part of the problem was that the engagement with our seniors with those programs was not very high because of trust, because there was a lot of scams on telephones or what have you. Well, so when we talk about using technology to be able to provide services more efficiently, we have a digital divide with the older adults. Not only for their age, but sometimes we also are dealing with socioeconomic issues where they don't have access to data plans, access to high-speed internet. So we have to be able to close that gap and close that digital divide. So when we're looking at these different systems and different kinds of technologies in order to do that, we have to look for technologies that have a low barrier of entry for user interface. And voice was very interesting. So seniors are able to use voice-activated artificial intelligence technologies so that we could able to capture information to deal with a whole host of things. So we're really excited about the potential of that technology.
So voice authentication, like you're using equipment such as like AI speaker, I assume that you're mentioning, right?
Yes. So for example, myself, I use a lot of voice activated, and I don't want to name any technologies out here, but I use a lot of voice activated artificial intelligence with my phone at home, with my smart home.
Yes.
Also, I just recently lost my father, and over the past, during the last 2 years, we use more technological tools to be able to help us during that time. We did that with my family. Imagine if we use technology better on the state level, and Assemblymember Ron Kim has been making sure that we try to address how do we do that on the state level, statewide, for our seniors.
I understand. Thank you. So when you decide to make a new policy to bring in new technologies for older adults in New York State when it expands to the United States, actually like an office for aging will be the department, the entity to implement and execute the budget, right? Yeah. So given that all the state leaders are very keen to bring in and apply new technologies to welfare system of New York and the United States, let's try to expand the scope of the discussion a bit and cover another critical issue that we observe in the New York State and the rest of the United States, which is the nursing home matters. So Ron, I understand that you're very keen to apply new technologies to solve like ongoing problems with the nursing homes in New York, right? Could you explain what you are trying to do and how it is going?
Thank you for that question. Let me backtrack a couple of minutes here. Whether we're dealing with older adults that's been waiting in New York State for almost 4 years for services, or older adults and seniors that are now in nursing home facilities and being neglected on a daily basis and even abused by the system. I have a new term to describe what's going on with older adults in New York and beyond. I call it social moral injury. And what this means for me is that families and communities are losing hope. They're losing trust in our government, in the private sector, in our system to solve social problems. That is a moral injury that is hard to come back from. So what we do now in offering solutions is more critical than ever. Because in order for our economy, in order for our communities to stay productive, to work hard, and to think that, hey, if I save, if I go to college, if I get a career, one day I can provide for my family and I can have a family, we need to have trust. But we're losing that if we have moral injury. So in nursing homes, I think there's an opportunity with technology. There's a clear opportunity. We have facilities, over 600 facilities in the state of New York. The majority of them have, it's complaint-driven, and there's so many people that are being neglected in these facilities, and there's no technology in most of these facilities. So imagine if we can come in with some of the best tools that's already been deployed in South Korea, that cost on average maybe $250 to retrofit an entire room for each patient that can monitor them, their heart rates, improve staff ratio by alleviating the care worker from the administrative duties to actually do the care work instead of doing and tracking paperwork. There's a number of things that technology can solve, but we haven't even scratched the surface yet. So in that sense, I feel very optimistic that we can use the best tools, the good tech, and have government buy-in and start figuring out, let's identify a couple of pilots, a couple of nursing homes, and let's start retrofitting and improving the conditions and show the rest of the country and the world what we can do with distressed nursing home facilities and how we can turn it around.
I understand. Thank you, Ron. Hopefully, you could find a good technical partnership from Korea also through this visit. Yeah. We've been talking about applying new technologies, including AI and others, for the welfare policies for older adults. Greg, related to providing better support and care for older adults in New York, do you have any priority groups in mind? Because I remember that we had a discussion on providing some high-tech equipment for NORCs in New York. And I also remember that I had a chance to discuss with the veterans, war veterans in the United States, and understand now that a lot of veterans are in need of a better care, especially veterans with the physical disabilities or loneliness, suffering from loneliness or depression, right? How's the situation in New York, and what's your point of view on that?
Well, I think you can wrap all three of those populations and more are our priorities. So in New York State, 70% of our veterans are over the age of 60, 400,000. What you're talking about with NORCs, if your audience doesn't know, that's called a naturally occurring retirement community. And then we have neighborhood NORCs as well. And that really is just people that had moved into a building or a neighborhood when they were younger and aged in place. So now most of the people are older now. Our priorities, I really like the question. I gave this some thought earlier. There are uses for AI, collection of social determinants and technology for all the populations we serve. So if 85% of older adults consider themselves healthy, well, and active, which they do, we want to maintain that. And I think that there's value in these tools to maintain good health and wellness, and staying engaged, staying active, having access to all those social determinants that I talked about earlier. Then there's a second pot of people or individuals with chronic conditions, right? And we have a lot of people, not only in New York but across the country, that's kind of the linchpin between whether you wind up, in the emergency room, a hospitalization, or in a nursing home. So there's unbelievable value for those individuals as well. And then our core mix are those that are at imminent risk of Medicaid spend down, which is our primary long-term care financing source, and nursing home placement. And just piggybacking on what Assemblyman Kim said, most people will never need to go to a nursing home if we were able to finance community care. Here's why. My average customer is an 83-year-old low-income female who lives alone, has 4 to 10 chronic conditions, has limitations, can't get up by themselves, bathe, dress, go to the bathroom, shop, prepare food, pay their bills, clean their house. Those are the services that we provide every day in the communities in New York State. We can keep somebody in their home and community by wrapping around these services for 5 to 7 years for under $10,000 a year. Yet we're paying $160,000 for a nursing home and the quality of care that Assemblyman Kim talked about. One final thing. We have 160,000 nursing home beds in New York State. We have 4.84 million people over the age of 60 today, which is going to grow to 5.5 million in less than 5 years. So where should we be focusing our attention in New York and across the country? It's in the community. And these tools are how we can get there.